Morning to all of you. Myself Dr. Varsha, and today I will explain about the pubis and ischium part of the hip bone. So we can see that is the pubis part, and pubis forms the anterior inferior part of the hip bone. So we can see that is a that position is a anterior inferior, and pubis forms mostly anterior 1/5 part of the acetabulum. It forms anterior 1/5 part of the acetabulum. Now let's talk about the parts of pubis. So it has one body, so we can see that is a body part, one superior ramus which is present superior laterally, and another one is a inferior ramus present inferior laterally. So as we can see, that is a body of pubis, and body of pubis has one border, that is called superior border. Only one border in the total hip bone in pubis is a superior border, and second is it has a pubis tubercle. So where is the pubis tubercle? Lateral end of pubic crest, that is a pubic crest. Lateral end of pubis crest is called a pubis tubercle. And third is it has three surface. First is anterior surface, posterior surface, and medial surface. So we can see that is the anterior surface, that is the anterior whole surface is called anterior, and it is a downward, forward, and slight laterally. It is a downward, forward, and slight laterally. Second is a posterior border. As we can see, that is a posterior border, and it is a smooth, and most important landmark is it is related to the urinary bladder. Third most important is a medial border. So that is a medial border. You can see that is a medial border, and it is articulate with the opposite pubis to form the pubis symphysis. So that is a medial border. Now we talk about the superior ramus. So as we can see, that is a superior ramus. Superior ramus is superior laterally present, and it has borders, three borders. Superior border, that is a superior border. If we अगर हम इसको lateral देखते हैं, that is a superior border. Superior border that is also called a pectineal line. Yeah, pectine pubis, because this is a pectineal line. And just behind the pubis tubercle, just behind the pubis tubercle is that is called the superior border. And second is a anterior border. Anterior border, that is called obturator crest. The border is rounded ridges extend from the pubis tubercle to the acetabular notch. And third one is the inferior border. As we can see, that is a inferior border of superior ramus. The inferior border sharp, that is a sharp, we can see that the structure is a sharp and forms upper margin of obturator foramen. It forms upper margin of obturator foramen. Now let's talk about the surface. As you can see, pectineal surface, that is a pectineal surface. Second is a pelvis surface, lies between the superior and inferior border. It is smooth. It continues with the pelvis surface of body of pubis. Okay, it continues with the pelvis surface of body of pubis. Third one is a obturator surface, that is lies between the anterior and inferior border. That is a obturator surface lies between the anterior and inferior border, and it present the obturator groove. This is the obturator groove. Now third one is the inferior ramus of pubis. Inferior ramus, as we can see, that is the inferior ramus of pubis. And earlier we have discussed that is a present inferior laterally. So attachment extend from the inferior ramus, it extends from the body of pubis to the ramus of ischium. So this is a inferior ramus. Now let's talk about the attachment of pubis bone. So firstly is a pubis tubercle. Uh, the main attachment is the medial end of inguinal ligament. As we know that lateral end of inguinal ligament is attached to the anterior superior iliac spine, and medial end of inguinal ligament is attached to the pubis tubercle. Second is a pubic crest. As we know, rectus abdominis muscle originated from the pubis crest, and adductor longus muscle, adductor brevis muscle, and obturator externus muscle that originated from the anterior surface of pubis, that originated from the anterior surface of, that is the anterior surface of pubis. Third one is the posterior surface or body of pubis are three muscles: levator ani, obturator internus, and puboprostatic ligament. There is a puboprostatic ligament. Next is a pectineal line. That is a pectineal line, and it goes attachment to the pectineal ligament of Cooper and pectineal muscle. That will be originate from the pectineal line. Next is the obturator groove. As we can see, that is a obturator groove. Their transmission of obturator vessels and nerve. So that the whole is a pubis. And now let's talk about the ischium. So we can see that is a ischium, and ischium present to the posterior inferior to the acetabulum. That is the acetabulum, posterior inferior to the acetabulum. The ischium position is posterior inferior to the acetabulum. It forms the posterior inferior part of hip bone. So it forms the 2/5 part of acetabulum. As we earlier discussed that 1/5 part is formed by the pubis and 2/5 part of acetabulum is formed by the ischium, and it forms the posterior boundary of obturator foramen. That is, it forms the posterior boundary of obturator foramen. So parts, now let's talk about the parts of ischium. It has body and inferior ramus. It has body, this part is a body, and inferior ramus. It has only two parts, body and inferior border. Okay. Ends of body of ischium, it has two ends, upper end and lower end. Upper end forms the posterior 2/5 part of acetabulum, and lower end forms the ischial tuberosity. So this is the ischial tuberosity. Now let's talk about the borders. It has three borders: anterior border, posterior border, and lateral border. Anterior border forms the posterior margin of that is the posterior margin of obturator foramen. Posterior border, it continue above the posterior border of ilium. Below it ends at the upper end of ischial tuberosity. It forms part of lower border of greater sciatic notch. So greater sciatic notch formed by the posterior border of ischium. Lateral border forms the lateral margin of ischial tuberosity. Femoral, it has three surface: femoral surface, dorsal surface, and pelvis surface. Femoral surface lies between the anterior and lateral border. Dorsal surface continue above the gluteal surface. And pelvis surface smooth and forms part of lateral wall of true pelvis.